The goal of ballistic type training is to really focus on velocity of movement. And so, what we're generally looking at here from a modality perspective is going to be jumps and medicine ball exercises. So, we're looking at very light loads. When it comes to jumps, we're looking at using body weight. Obviously, if we start to add external load, then we're going to slow down the speed of movement, and we're actually addressing a different part of the force velocity curve. From a medicine ball perspective, we're looking at anywhere from probably 2 to 10 pounds, depending on the movement and depending on the abilities of the client in question. But the ultimate goal, then, of course, of our ballistic type training is to have a shift in this force time relationship to the left hand side. In this example, we're seeing the dashed line is the post training result. The solid line is pre training. So, as a result of spending some time on developing ballistic abilities, the person is improving their rate of force production, and in a certain restricted time frame, we are seeing greater force application. From a sets and reps perspective, we're looking at, again, both jumps and medicine ball type exercises. From a reps perspective, we are looking at about 5 being optimal, up to 10 being acceptable. So it's quite common. You'll see anywhere from 3 to 10 repetitions programmed. Anything beyond 10 repetitions, we're really getting out of the purpose of ballistic type training and the purpose of jumps, which of course is explosiveness, and we're really just getting a metabolic effect. From a reps per session perspective, so the session volume is anywhere from about 25 to 50. The total number of reps per week, so the weekly volume is anywhere from 100 to 150. The loads we know are light, so body weight or light implements when it comes to the medicine balls itself. Rest interval is suggested to be 2 minutes. And this is the kind of textbook rest interval to make sure we have complete neuromuscular restoration so that every repetition is as explosive as possible. However, we have to think about the reality of this. Do we really need a full 2 minutes to recover from a set of 5 medicine ball throws? Now, this also brings us to the point of logistics. There's a lot of things to be done in a comprehensive program, and so maybe we don't have time to sit there and rest passively for 2 full minutes. So it's quite common to pair ballistic exercises, specifically pairing jumps with med ball. So we might do a box jump, and then while we're recovering from the box jump, walk over to the med ball wall, do our explosive med ball, and then go back and forth. And this kind of takes care of that suggested rest interval. We do see great variation in the reps per session and in the reps per week, but that's because it really depends on the frequency of training, the movement difficulty, and training age, etc. So we're going to go into a little bit of volume distribution examples. We'd suggested that anywhere from 5 to 10 reps is common and accepted. And once you start getting over 10 repetitions, we're really not focusing so much on power anymore, as much as just inducing a lot of systemic fatigue. So if we take a look at jump height versus number of repetitions here, obviously we are seeing preservation of power over our first 5 repetitions, and so that's great. From a specificity perspective, if I want to develop peak ballistic abilities, I want to make sure that every repetition is being performed with peak ballistic abilities. Then we take a look at what happens when we transition from 5 to 10 repetitions. And what we notice is that we're still able to preserve peak power fairly well. We're starting to dip below most likely 80% of our peak power. And then, of course, as we extend the set towards 15, 20, 30 repetitions, etc., we're going to see a significant drop off in power and peak jump height, and a significant increase in the respiration rate, heart rate, and all of those types of things, which brings us to that metabolic effect. But the purpose of medicine ball training is generally kinetic linking. It's a great opportunity to link lower body power generation and then have that power be transferred through the core out through the upper body. And this very much happens in real life. So this is where medicine ball work is often considered one of the ultimate transfer of training exercises. In the golf swing here, you can see that the power is being generated by lower body extension and hip rotation, etc. And then, of course, that power is being transferred through a stable core out through the upper body through the golf club in this example. And we can see a similar pattern being used in this rotational med ball throw where he gets back, loads the hips. We see hip extension along with simultaneous rotation, and then that power is distributed through that stable core out through the medicine ball. When we're picking medicine balls, there's 2 types. There is a rebound ball, which is obviously great for repetitive stretch shortening cycle actions, but then we also have a dead stop ball. Dead stop balls basically drop to the floor as soon as they hit the wall, regardless of how hard you throw them. So this can have implications if you're in a facility. The rebound balls, of course, they run the risk of bouncing and rolling on the floors, but again, they are great for repeated efforts. Dead stop balls then are great for singular efforts, and of course, they don't roll all over the gym floor. Getting into some specific examples of med ball exercises that are commonly seen, it's important to understand the purpose. Why are we utilizing the medicine ball? And the medicine ball, as we've already discussed, is used for training ballistic abilities, often using kinetic linking. So these are the examples of what we want to see. These are both from strength coach Eric Cressy. And as you can see, that these movements are explosive, they are aggressive, they are violent, they are as explosive as humanly possible, very, very high from a velocity perspective. These other ones, this is a crunch, which we know is contraindicated for many reasons, but then you think, what are we doing with the med ball? Oh, we're adding, okay, so it's a weighted crunch. We're not really using this med ball the way it's supposed to be used. Similarly with this Russian twist, I mean, you can see the smiles. It looks like it's real fun, but contraindicated, fairly useless exercise. And again, fairly useless. What's the med ball doing? Pretty much nothing. Maybe making it even more contraindicated due to the extra force on the lumbar rotation from the med ball. But this also goes to show, if I had these, two people doing partner rotational med ball throws, right? We don't want to be using a partner when we're throwing a ball, right? A weighted ball as hard as humanly possible. So partner med ball stuff is not a great option unless you are doing partner assisted chest throw, where someone is supine on the floor, throwing the medicine ball as high as humanly possible. Someone's going to want to catch that for you. Then we look at two other common examples, which again, you can identify as just not being it when it comes to the purpose of med ball work. I believe people call these wall balls, which I think is a weird name, but it really just ends up being a squat, and then you're throwing, a 3-pound ball overhead, and it's usually done for multiple repetitions. So if we think, what are we getting out of this? A metabolic effect. And that might be exactly what we're trying to get. So looking at this and saying, well, that's an awful exercise, I don't think you can blanketly say that. I think we have to understand the purpose. This movement here is not the same as this movement here. We are not getting the same ballistic adaptation that we would get. And then, of course, this is something we commonly see, which is just no integration of the lower body to the upper body. This is not being done very ballistically or aggressively, etc. Now, we also have to keep in mind, though, repetitions when we first start to coach people are not going to look like this, right? We're going to probably start out with a little bit slower from a velocity perspective so we can nail the movement pattern and then progress towards proper explosive ballistic type work. When we're programming medicine ball exercises, we want to be mindful of three things, and that is the type of throw we're programming, the client's position for the throw, and then the orientation to the wall. We have 5 different types of throws. We have rotational throws, chest throws, overhead throws, scoop throws, and then approach. Here are some examples. This is our chest throw where the ball starts at the level of the chest and is then thrown. Here's our rotational throw where the client is going to rotate around their body. We have our overhead position. This can be done for a slam or directed towards the wall. This is our scoop position. And in this example, the client is going to explode through their hips, knees, and ankles and propel the ball as far as humanly possible, as high as humanly possible behind them. Here's an example of an approach. So you can see the person is stepping into their left foot on this example, bouncing back to their right foot, and then exploding away. This allows us to exploit the stretch shortening cycle to a greater degree and have a more powerful medicine ball throw. From a position perspective, we have 4 possible positions. We have our tall kneeling, our half kneeling, split stance or square stance when we're standing, and then our lunge position. Finally, we want to be mindful of the orientation to the wall. Is the client facing the wall, which we would call a front position, or are they sideways to the wall, which we would call a parallel position or a side position? So in this example, you can see that the client is going to be throwing the ball forwards, so they're facing the wall. However, in this one, they're going to be rotating and the ball is propelled that way with the wall here. Look at the feet orientation. That person is in fact sideways to the wall. The client positions are obviously self-explanatory. Looking at the volume distribution based on the frequency of training, we have 4 different examples here. So let's draw your attention to the first one. And as a reminder, we were saying previously anywhere from about 25 to 50 throws per session, and anywhere from 100 to 150 throws or jumps per week from a volume perspective. Now, these are guidelines. So if someone's training 2 times per week and we do have ballistic type work incorporated, we're probably going to do anywhere from 20 to 40 reps in each of those sessions. This is going to give us our weekly volume of about 40 to 80. Now, remember the weekly volume was suggested to be anywhere around 100 to 150. But we know that one of the advantages of an increased training frequency, whether the goal is hypertrophy or strength, etc., is that it does allow us to get more volume. And so that is just one of the limitations of a 2-day training program. We don't have the opportunity to reach the weekly volume recommendations that we would want. Now you might say, okay, well, let's get ourselves to 150. Why don't we just do 75 reps per day? Well, now we're looking at excessive volume that might compromise recovery. Also, how explosive are we going to be able to be when we're doing a total of 75 total reps? So again, that just ends up being a limitation of training frequency here. Much more common then would be our 3, 4, or 5 sessions per week. Here we see the volume distribution changes a little. If we're on our 3 session per week, 30 to 50 per session, that is going to get us into our range of anywhere from 90 to 150. Now you might be thinking, well, 90, that's a little bit less than you suggested previously, which is 100. But again, this is a principle-based field, roughly about 100 to 150. So 90 is going to fit the mold here for us. 4 sessions per week, maybe upper, lower, or push, pull. Doesn't matter how we distribute it, but we do have our client going to the gym 4 times per week. And so we can now decrease the volume per session a little. 25 to 40, 25 to 40, 25 to 40, 25 to 40. And then when the math is done, we're anywhere from 100 to 160. Again, we've exceeded some of the recommendations here a little bit. Probably not the biggest of deals. Finally, if you do have someone training 5 days per week, then of course the daily volume simply drops even more to get us into that recommended range. Now we're going to look at a couple of examples of what 30 throws might actually look like in a real program. As a reminder then, the order of a comprehensive session is here for you. And a reminder that we are going to be doing our ballistic type work nice and early in the session. So after the warm up, so the nervous system is primed and ready to go, we have yet to expose the muscles to a ton of force, things that would have maybe resulted in a lot of muscular fatigue that could limit our ballistic abilities. Remember, train fast to be fast. So we want to do all this stuff while the nervous system and the muscles are nice and fresh. Getting into the actual examples here, this is our straight set example. So we're going to do our sets. Then we're going to rest, do our next set, rest, do our next set, and rest before moving on to the next exercise. So the first exercise, we have stand, rot, side. We have to understand that this is going to be a standing rotational throw sideways to the wall. So what that's going to look like is here. There's our standing rotational throw on the wall, of course, would be here. And that's where we get. So we can see one of the challenges, of course, is making sure that we have properly described the exercise that we want. We have 3 sets of 5 repetitions here. The load is going to be noted. So is it a 6-pound ball, 5-pound, 4, etc.? We would make note of that. RPE, this really is just the effort, right? We just want this done to be explosive as humanly possible. So yeah, when the client says, well, how hard do you want me to throw this? As hard as you possibly can. Rest ideally is going to be 2 minutes in between sets. We put an asterisk here because logistically, can you really afford to sit there for a full 2 minutes? Now, the second exercise is a standing overhead throw with a step. Again, 3 sets of 5 repetitions, 4 pounds. Let's look at a more common and time-efficient way to program ballistic work, and that is by pairing medicine ball exercises with jump or plyometric exercises for the lower body. So our first exercise here is the exact same one. Standing rotational med ball throws, and we are oriented sideways to the wall. And then we're pairing that with a box jump. Notice rest 2 minutes here. This isn't really going to be the case necessarily because we're just going to go. Client is going to do their med ball work. Then they're going to move over, walk to the boxes, maybe get a drink on the way, perform their box jump, and then revisit, of course, their next set of med balls. So ultimately, it's just like we always do when it comes to paired sets or trisets. It really is just a time efficiency type of thing. And then you can see down here we have another pair. We discussed different positions for medicine ball throws, and these positions exist on a progression continuum. That is, we start with things that provide a low degree of freedom. That is, we don't have a ton of freedom to move through, let's say, the ankle and the hip and stuff like that. So we're in more of a constrained environment. And then we progress to movements that have a higher degrees of freedom, which means they're going to allow for more hip rotation, more utilization of the stretch shortening cycle, and of course, then more power. So from a progression perspective, we'd be looking at starting up here and working our way down. So tall kneeling positions are very stable, but it does not allow for much motion at various joints. We don't get a lot of hip rotation, etc. Then we move to our half kneeling position, which allows us to have a little bit more freedom through the hips. Same thing with our split stance or lunging. And then we get maximal freedom of motion in our standing positions.